But now they have to get out of the car and deliver the mail an extra 20 inches or so. It's not a long difference, but it is the difference between Brian getting his mail and getting nothing. Because you do understand that when you take something of someone else's without asking, that is, by definition, stealing.
No, I didn't look at that at all.
The big question is, why are so many steps being fast-tracked in the process of these bills? We came here to the state capitol to ask that very question. Name brand bottles can have as little as 30 pills in them, while generic bottles can have 500. So let's break these down on a per pill basis. This has turned into a dire situation at Kingston, a hot spot of coronavirus, 80 plus positive cases now, 5 people hospitalized, 7 people dead. Assembly Bill 72 is a great example of a blank bill. It started off just like this, just one lonely sentence, and then it became all of this. Less than 2 weeks later, it was on the governor's desk being signed. So the question is, when did one sentence become all this? All of Elizabeth's stuff has been on the sidewalk since Wednesday, the same day this eviction order was issued that says the landlord needs to keep her stuff safe for 15 days. 20-foot pine trees now stand where the old sawmill once was, and even though those trees have grown, this town hasn't. Half of all COVID deaths in Kern County stem from Kingston Healthcare Center, a nursing home which our investigation uncovers is in hot water with the feds. A Medicare database labels Kingston a special focus facility. That doesn't mean Kingston has a special focus. It means Medicare is especially focused on Kingston due to a pattern of failure. Failure a nursing assistant's daughter tells me is constantly covered up.
She was complaining about a lot and nothing she could do about it because they throw stuff under the rug.
So tonight, we're uncovering the shortcomings of this nursing home, starting with their most recent health inspection when they racked up 39 citations, 3 times the state average and 5 times the national average for a nursing home inspection. Next, we look at staffing.
A lot of people that work there know that it's not running right.
Licensed nursing staff at Kingston spend an average of an hour and 16 minutes with each patient. That's a half hour less than the state average.
The client wasn't getting the care that they should be getting because they're short-staffed.
Our investigation shows Kingston's continuous health violations and short staff are leading to poor patient outcomes, even death. Compared to the average California nursing home, short-term residents at Kingston are 35% more likely to end up in the hospital and 500% more likely to develop ulcers. Long-term residents at Kingston are 50% more likely to go to the hospital, 75% more likely to develop an ulcer, 70% more likely to get a UTI, 32% more likely to lose mobility, 250% more likely to be restrained, and 47% more likely to lose too much weight.
They don't care about them clients. They don't care.
All of this is why Medicare says Kingston has not improved in 20 months of being a special focus facility, putting Kingston in danger of losing Medicare status, the way most of their patients pay their bills, according to our research, which shows Kingston's income is 25% more reliant on Medicare than the average American nursing home. Hundreds of dogs have come through the McFarland Animal Shelter. 481 in the last 2.5 years. I looked at the intake forms and kennel cards for every single one of them, and some things just didn't add up. Some kennel cards are missing information. Other cards are entirely blank, and none of them specify what day the dog was brought to the shelter. The bad bookkeeping extends to this portion of the kennel card, declaring if the dog was posted on the shelter Facebook page. So I cross-checked each and every dog using their animal ID number. Here's what I found. Of the 336 dogs that should have been on Facebook, I could only find 57 of them. So I went to the animal shelter to ask the head animal control officer, Oscar Maya, why the paperwork doesn't line up.
Once I post up a picture, they're up there for 72 hours or more, depending on how long it takes to get them out. And then once I get a rescue saying yes, I bring the picture down.
Maya says this is to avoid confusion, but it only makes things more murky. All 57 dogs I found on Facebook were already rescued.
I just guess never got around to removing those pictures down.
And the confusion continues from there. What about the other dogs? The ones with kennel cards showing they were never posted on Facebook.
Most of the dogs that we put up on social media is because they're strays. We don't know who the owner are, so there's no way of letting the owner know we don't have them.
The problem with Maya's answer is we found 85 cases of stray dogs brought to the shelter that were never put on the Facebook page. The final red flag we found is in this entire stack of kennel cards from the last 2.5 years, only these 3 say the dog was euthanized. However, according to budget reports for the shelter, it says they've spent $5,800 on animal disposal in that same time frame. So how many dogs are they really putting down?
Right now, in the last, I would say, quarter, I think I've only euthanized, I would say, 2 dogs so far.
So roughly 2 dogs every 3 months, maybe 2 or 3 dogs every 3 months or so?
Roughly, if you want to put it, yeah, roughly.
Why are only 3 kennel cards in 2.5 years saying euthanasia?
Euthanasia. That would be because some of them, like those were probably requested public records, so I just went ahead and put that information on the kennel cards, but since I keep track of it through the other one, I keep it simple that way.
So what is going on at this shelter? Why are there so many inconsistencies in their bookkeeping? I asked Maria Laura, McFarland's Community Development Director, who oversees the shelter.
We are limited. Our resources are very limited. I wish we had, 2 full-time ACOs, but we don't have a budget for that.
Simply put, the shelter has 1 full-time employee, no central office, no volunteers, and things have slipped through the cracks. That's why Laura believes the new shelter facility we're standing in will help turn things around.
It's going to be awesome. It's going to help them, and it's even going to help me to be able to supervise them better, because we're not only getting a computer, but we're also getting cameras in this facility.
Maya also believes the new shelter will help make his process more transparent. But until the new shelter opens, Maya swears the dogs are cared for, despite the paperwork gaffes. At Milan Institute in downtown Bakersfield, students pay thousands of dollars to be trained for beauty and massage careers. Despite the high cost, the school needs money, and according to Justin Leland at MoneyWise, they've broken the law to get it.
There's a lot of different ways to handle the situation without going into stealing from your employees.
Eyewitness News obtained documents showing retirement money was being taken out of employee paychecks, but Milan wasn't putting the money into employee retirement accounts. A Milan spokesman claims it was human error, but a whistleblower gave me this email from HR which says Milan withheld 401k contributions for 9 months on purpose because they have a, quote, very unfortunate cash flow situation. Leland, a 401k expert, tells me people could go to jail for this.
The IRS deems this as being a loan from the plan, and so if you're taking a loan from the plan, it is highly illegal. It's known as a prohibited transaction.
Our whistleblower says employees were told not to tell the press about this problem, something the Milan spokesman says isn't true, but we came to Milan Institute and we actually saw the director telling people not to speak to us. Also, texts from inside the school say people were directed not to speak to us, even saying they locked down the building until we left. Pharmacies all over California are feeling squeezed, not by drug companies, but by the government. It's even happening here at Ming & H drugstore in Bakersfield. For 55 years, they've filled prescriptions, but now Medi-Cal is making it tough for them to keep going.
Yeah, I want to take care of my customers the best I can, but at what point do you say, look, I'm drowning?
The issue is brand name versus generic. Pharmacist Pat Person shows me a bottle of Wellbutrin XL. It costs $1,700. The generic is only $100. Despite the massive price difference, Medi-Cal requires Person to give Medi-Cal patients the brand name. Name brand bottles can have as little as 30 pills in them, while generic bottles can have 500. So let's break these down on a per pill basis. I found 3 medications that Medi-Cal requires the brand name. Wellbutrin XL costs $58 per pill. The generic is 20 cents per pill. Proventil inhalers cost $77. The generic is only $35. And Crestor costs $8.27 per pill, while the generic is only 15 pennies. So why is the state doing this? Short answer, they're taking money from the drug companies. The California Department of Healthcare Services tells me the drug manufacturers are paying the state so much, the brand names end up costing less than the generics. But at Northchester Pharmacy, owner Brock Allison says that makes no sense.
You have a $1,300 product, okay? You have a generic that costs $5. Where does the money go?
Allison wants to know where the money goes because it's not going to the pharmacies. Both he and Person lose money every time they fill one of these prescriptions because Medi-Cal doesn't reimburse them the full cost of the brand name drug.
Yeah, it's a struggle. It's a struggle. We have really had a tough time keeping our balance sheet in the black.
While forcing the pharmacies to take a loss, the government is stockpiling drug company money. Last year, Medi-Cal prescriptions only cost $3.5 billion, but the kickbacks were $4.4 billion. I asked the government if pharmacies saw a dime of that extra money and was simply told, no, the government keeps that money. Meanwhile, locally owned mom-and-pop pharmacies are struggling to get by, caught in a vicious cycle where they lose money and the government runs away with drug money rebates meant to offset the cost. Now, Person is worried pharmacies will close, and those on Medi-Cal, the most in need and vulnerable patients, will lose access to their meds.
It's hard to look them in the eye and say, I can't fill your medication because I'm losing money.
Still, the government is requiring these brand name drugs when a much cheaper generic alternative sits right next to it on the same shelf.